Welcome back to DXB Today, where we're talking all things health and wellness, as well as fertility as well. And to help us with that, we welcome Dr. Serge Mattar, Reproductive Endocrinology and Infertility over at Dr. Sulaiman Al Habib Hospital. Thank you so much for joining us today.
Thank you for having me.
Now, there's a lot of talk, and we've been talking about freezing our eggs, but tell us a little bit about this concept of ovarian tissue freezing.
So both egg freezing and ovarian tissue freezing fall under the umbrella of fertility preservation. But as the name suggests, in egg freezing, you extract and freeze individual eggs. Whereas in ovarian tissue freezing, you remove parts of the ovary or even the entire ovary, and you freeze the whole thing with all the immature eggs that it contains.
Wow.
So when you say remove the entire ovary, you actually remove the entire ovaries and freeze it. Is that for everyone, would you say?
No, so basically ovarian tissue freezing is particularly beneficial for women who will undergo medical treatments that will harm their ovaries, such as chemotherapy, radiotherapy, or for women with family history of early menopause, or those, for example, who carry certain genetic diseases that put them at risk of early loss in the function of the ovary, or what we call premature ovarian insufficiency.
So could you walk us through the process? Like what happens if you're going to do the ovarian tissue freezing?
Certainly. So the process consists of 3 key stages. Stage 1 is a laparoscopic surgery or a keyhole surgery where you remove the ovary or parts of the ovary. Stage 2 is the freezing, where the removed tissue is processed and frozen. And once frozen, it can remain on ice as long as you want.
And you don't have to do any injections, there's no hormones?
Nothing at all, just the surgery.
Oh.
And stage 3 is another laparoscopic surgery later in life when the woman is ready to get pregnant in order to transplant the tissue back inside the body. So it's exactly like hitting pause on your biological clock and then pressing play to reactivate it later in life whenever you're ready at your own convenience.
Incredible.
Doctor, can you tell us about when you start to make this decision? Is this like right after a diagnosis? How do you start to fold this into your medical care?
So if we take a step backward, if you're eligible for regular egg freezing, it's still the key, the gold standard. However, for regular egg freezing, you need to meet 2 criteria. 1, to have adult ovaries able of producing mature eggs, and 2, to have the time privilege to undergo hormonal stimulation, which might take around 2 weeks in order to be able to extract these eggs. So ovarian tissue freezing is reserved for women where immediate action is needed, like cancer cases, where they need to start their chemo or radio. They cannot delay that by 2 weeks in order to take the hormonal stimulation. Or on the other side, for young girls who haven't reached puberty yet, and therefore their ovaries cannot produce mature eggs. So yes, it's an immediate decision. As soon as she's diagnosed with cancer, with the following discussion with her oncologist, we proceed with our surgery, we remove the ovary or parts of the ovary, and we freeze them.
It sounds like a very, very serious and important decision, especially you mentioned it's not just cancer patients, it's also people who have certain family history of early menopause and things. It is a big decision. I mean, if you're 22 years old and if you do have a family history of early menopause, I mean, do you take your chances with this? Because it is quite extreme to have your ovaries removed, especially when you're perfectly young and healthy, just because, you know, there might be a chance that you may not be able to conceive.
Absolutely, I totally agree. It's not always an easy decision, but we usually base the decision on certain clinical evidence and strong scientific data. And if it turns out that yes, she's a carrier of this genetic disease, or if she's at high risk of early loss in the function of the ovary, then I think after adequate counseling, she's well positioned to take this decision.
So this sounds like such extraordinary healthcare to be folded into an oncology practice. Is this something that's currently available in the UAE?
Not yet. So not only in the UAE, it's not yet available in the entire region. And this is what we're currently working on, and hopefully we're aiming to be the first center to establish this service.
Well, I think some of the concern with it would be the safety. How safe is it? Because it sounds quite invasive.
So, as you might expect, safety is a top priority in any medical procedure, and ovarian tissue freezing is no exception. And the main concern here, since in majority of cases it's done for cancer cases, we worry whether we risk of reactivating cancers or spreading cancer cells again inside the body once we transplant the tissue back inside the body. But I can assure you we run extensive molecular testing on the tissue to make sure it's cancer-free. And the process has been refined over the years, and by now I can firmly say it's super safe and it's a very well-established technique of fertility preservation.
Dr. Serge, this is some important stuff. So many of my friends are currently trying to conceive, and this is some very important information that you've shared here with us. Thank you so much for your time today, and thank you so much for everything that you have shared with us today.
Pleasure. Thank you for having me.
Right. Today's spotlight is on a company creating sustainable health products to optimize healing in the wellness industry. A trusted partner for natural remedies, this is Dr. Heike Leib Wilson from Brightly Labs.
My name is Dr. Heike Leib Wilson. I'm the CEO and founder of Brightly Labs. Brightly Labs is a well-being brand which takes care of the holistic approach of well-being for men and women likewise. I'm trying to create and educate people on collagen. Collagen is a huge part of our body, and over time, from the age of 25 onwards, our body produces less. And so it creates a deficit in our body. By taking supplements, collagen supplements in particular, it will help us to slow down the aging process. And that's something I'm addressing and educating people around me. As a startup, you face lots of challenges. And I think life is all about challenges. So for me, it was really to understand the process to get product registered here with the Dubai Health Authority and Montachi and so on forth. However, for me as a self-employed or startup, it's also part of the journey, and I embrace it and I work with it. My long-term goal of my business is to actually grow it to a $100 million business, because it's really important to everybody and it caters to everybody. And I feel, or I know, the brand has the potential to be a $100 million business over the next 4 to 5 years.
Thank you, Dr. Heike. But now it's time for the roundup. Amy, what have you got for us?
Well, Faris, Dubai's clinics have seen a 2,000% surge in women freezing their eggs. 2 years on from the UAE's legal reforms, clinics have seen a 20-fold increase in women opting to freeze their eggs. The law stipulates that human embryos can be frozen for up to 5 years, and clinics have invested in the state-of-the-art equipment and research, ensuring that the egg freezing process is safe and effective. Well, I'm kind of not surprised by those numbers, actually, with them just recently saying that single women can freeze their eggs. So before it was only married women that could freeze their eggs. Cassie, I mean, what's your take on that?
You know, I think it's fantastic. I think that the conversation has really evolved around this. I think we've got women like Jennifer Aniston talking about how she wishes someone would have told her to freeze her eggs when she was younger. And I think that this message is getting out to women now, and the stigma is sort of draining away from it, and it's becoming more of a self-care health decision and less of a kind of stigmatized thing that we don't really talk about. And I think that's fantastic. These are good times to be thinking about these healthcare decisions that we can make for ourselves and to do something proactive about them.
You know, it's interesting you said that, because I was having this conversation at a dinner table, and what I said was that when my daughter is 25 years old, I'm going to encourage her to do 2 things. One is, of course, get her cervical cancer shots, and the second thing is, if she cannot afford it, I'm going to gift her the option to have her eggs froze, just because I don't want this stopping her to pursue whatever she wants to do in life, or really, be on any kind of time crunch or anything. And at the table, everyone looked quite surprised, because they probably didn't see this coming from my mouth. But I just think that I personally didn't struggle with it. I married quite early at 27, or at least 27 is considered early right now. Managed to conceive by 30, but that's not necessarily the case for a lot of women. And I don't want this stopping them or holding them back, or having to rely on having a partner or a relationship. So I think freezing your eggs at a young age is definitely recommended. I'm very pro freezing.
Now, most of what I know about IVF comes from the TV show Friends. I'm sure it's not the most accurate. I don't know if this is a 90s thing, but in the show, they alluded to the fact that a frozen egg isn't as effective as one that's in the ovary. Is that still the case, or is the technology improved?
I don't think that's something to be overly concerned about. 90s sitcom medical, we've moved on a little bit. But it is, your chances are very, very good with a frozen egg. And in fact, in IVF cycles these days, you almost exclusively do frozen embryo transfer. So that's not just a frozen egg, it's an entire frozen embryo. And more often, that is the case, that you're coming back some months later and doing your transfer.
What question do you get the most when it comes to people coming to you?
I think, is it going to hurt? People want to know. And it can be a little uncomfortable, but it's not horribly painful. You have a lot of hormones in you. People want to know, are they going to feel crazy? Are they going to be very emotional? And we talk a lot about how when you're going through this, you do sign up for a season of discomfort, is kind of how I explain it. That you're going to have a lot of doctor's appointments. You're going to be giving yourself a lot of injections. You're going to be thinking exclusively about this thing that you're doing, and it really does take over. But then, God willing, so does pregnancy, right? And so does birth giving, and so does raising a child. So.
I'm curious, Faris, do you also get your medical advice from Grey's Anatomy?
Oh, no. Just friends.
Just friends. Right, up next, we find out what goes into a LASIK eye surgery with the head of ophthalmology at Al Zahra Hospital. Plus, we've got the melodious Amjad Shakir playing us out, so don't go anywhere.